about what you guys are doing, but this is the first meeting I've been able to attend.
Thank you so much for joining us. Keeping tabs on our healthcare sector.
And my name is Chelsea Reinberg. I am a dietetic intern working with Shelley and Robin at the Weighing In for Children's Mercy.
Excellent. Thank you so much for joining us, Chelsea. Oh, hey, Dr. Fisher. Thanks for joining us.
Yeah, thank you. Glad to be here.
Do you want to introduce yourself real quick?
Oh, yeah. So I'm Mark Fisher. I'm one of the peds rehab attendings at Children's Mercy, and I am involved in the adaptive sports medicine program, kind of developed and run that. So focus on physical activity for kids with disabilities.
And I feel like you've been open my email. I've seen your name a lot lately, so thanks for everything you've been working on. Anyone else that I missed that's new? Okay, well, if you join on, go ahead and type in the chat. But I'm just going to get started because we don't have a lot of time. Thank you guys so much for joining us. Just a quick review. We are the healthcare sector of the Kansas City Physical Activity Plan group, and our focus is really trying to figure out how we as healthcare workers can reach out to our patients and our families and try to get them more physically active to improve overall health outcomes and just be happier. So I feel like exercise is such an important part right now in this pandemic. And so this is just a really important group, and I really appreciate all of you guys being here to help out with that. So there are a few bullet points that we wanted to start out with today. And then at the end of this, if any of you guys are doing anything specifically with your patients, so we can kind of KCPA plan, little kind of like logistical map that we're working on. Other options for that would just be to kind of put in the chat anything you guys are specifically doing to help encourage physical activity at this time. So the first thing that we were going to talk about was the Just Walk, formerly Walk with the Doc organization that helps promote physical activity through actually having physicians or other healthcare workers walking with their patients. And we had that possible from the Kansas Health Association to start a site. Oh, sorry, I had some echo. To start a site here at Children's Mercy. Shelley has been working nonstop, I feel like, to help get this going. I'm going to turn off my camera for a sec. Is anyone else hearing an echo, or is it just me? Okay, is this better? No. Shelley, do you want? Yeah, okay. So we have started the process, gone through the process. We've formed a subgroup to work through this process, and we were at a September 11th opening day, which got put on the back burner because of COVID. So we could not get it finally authorized with our Children's Mercy higher ups to allow that to go forward. So we are moving forward with the agreement with Walk with the Doc and KHA, but we have not set another date to start that. And at this point, we're starting to get into fall, into winter, so it will likely be pushed out into the spring. But if we have any more updates on that, we'll let you know. And what we were aiming for would be the second Saturday of every month. We were going to meet in Pearson Park out in Wyandotte County and walk from 9 a.m. to 10 a.m. And we start with a 5-minute brief presentation about a healthcare topic and then go into the walk. We kind of have all of that stuff figured out in our brains, but we have not obviously put it forth in a walk yet. But more to come. And if you guys are interested in helping out, you can definitely email us for more information. I'll put my email in the chat. And if any of you guys know of any other walks that you have participated in, I know there's a few other sites here in Kansas City, let us know about that as well.
An additional piece to that, we've had this group has been working on moving this forward as a subgroup. There are 2 sites in the Kansas City Metro that currently host this program. One is through KU Med and one is through UMKC. At our next Just Walk meeting, we have invited the leaders of those 2 programs to share a little bit about their walks and how we might do 2 things. One, support their walks by showing up as volunteers and supporting them. Learn a little bit about their logistics and how they're managing it. And 2, talking about how we might coordinate our efforts moving forward so that health systems across the metro are leading these sorts of walks and we are supporting each other in doing it to make it easy for Kansas Cityans to participate no matter where they live. If anyone would like to participate in that Just Walk meeting that isn't already on the list, either put that in the chat or send me an email and I'll get you added to that.
And Sammy, that's a great question about doing a virtual walk. We had not broached that subject yet just because we were so hopeful that we'd be able to do an in-person walk. Certainly something we could talk about when we have our subgroup meeting, but again, that would need to be approved by Children's, and at this point, that's not approved right now.
Once we get the overarching agreement in place, I think that's certainly a reasonable approach, especially managing or trying to get this started if we want to try to get this started over the winter. So great idea. Jody, I think you're on mute.
Gosh, it always happens. The next thing we were going to talk about, since Dave and Jay are both on the call, is the exercises medicine curriculum that we're working on incorporating into the UMKC medical student curriculum that Jay's already leading some lectures in that. So do you want to take over and let us know how that's going?
Sure. So, sorry, I'm outside because there's a lot of noise in my house at the moment, and now there's noise outside. Yeah, so I haven't actually done any exercises medicine lectures yet at the school, but we're still trying to work on when we can do that, when the timing is for that, and making it sort of a curriculum. But I doubt it's going to be anything more than a lecture or 2, at least this year. And I honestly don't know if it's going to start with the med students or the PA students. I've worked on some lectures over at UMKC for some other part of their clinical practice of medicine curriculum. But I don't think it should be too hard. But Stephanie Ellison and I haven't finalized anything yet. So.
Thank you, and Robin can definitely. Do you want to elaborate on that a little bit, Robin? Or Dave, if you have something additional to add?
No, kind of slightly up. Shelley sent an email. One of the things that we also talked about was billing for exercise counseling and stuff, and this will be a quick thing, but I hit a lot of roadblocks with getting somebody to tell me how things are or are not being reimbursed. It's possible I'm not asking the right questions or approaching the right people. So I'm going to continue to explore that quite a bit to see if that's happening. But regarding the exercises medicine stuff, one thing that I thought we hopefully could circle back to is re-identifying what the primary barriers were that we're reaching regarding adding some sort of this curriculum to med student curriculums. I know we talked about this a long time ago, but what are the roadblocks that we're hitting for the most part? Is it time? Is it just acceptance of the idea? Is it where were we with that?
Well, as far as, I don't know if Stephanie's on the call, but as far as the last email I had with her, they just hadn't made a decision yet in their curriculum group for the medical school. And I haven't talked to anybody specific about the PA students or the other healthcare professional students, if that's even something that they would be interested in having in their curriculum. It's just they've kind of got their stuff set up, and they just haven't made a decision if they can fit it in yet, I guess.
Okay,
Hi,
that makes
this is
sense.
Stephanie Ellison. I am on the call. And we are having a curriculum retreat coming up here in early October. And that's a time where a lot of different courses have an opportunity to look at things they want to add. Clinical practice of medicine is probably the most appropriate place to put exercises medicine and lifestyle curriculum. Were they open to you revising your lecture as it is, or even adding another lecture, or is it that they just didn't have room?
I haven't heard anything specific. My other lecture really had nothing to do with exercises medicine. It was just about clinical skills. So it would be something entirely different. So it'd have to be added on.
Okay.
But yeah, I was thinking lifestyle medicine as well was where it would belong.
Yeah. And so I can kind of see what the direction is of the different courses, and that's the opportunity to take a sort of an overall look at the curriculum. And I know internally they're looking at a more wellness and lifestyle choices for medical students who are becoming professionals. And so, we can't really encourage wellness and activity changes for our patients if we ourselves aren't doing so. And so I know that that's a topic right now in terms of wellness of professionals that they're trying to embed. So I am at the curriculum retreat, so I'll just kind of ask the group about what their movement is on that. I'm in the clerkship group, so that's year 5 and 6. So I won't be at the table for the year 3 and 4 stuff, which they're not really looking at as closely at it. So I think the real movement can be on working with the course director for clinical practice of medicine in year 3, and starting to add those elements, and then just seeing where else we can put that in the curriculum. Just kind of a longitudinal curriculum in different courses and working with course directors.
Hey, Stephanie, I got a quick question, and this is coming from mostly an area of being totally naive at how this whole thing works. Is there, I'm trying to think of how to ask this. When it comes to adding exercises medicine type of curriculum into existing courses, is there an option to maybe create a new, maybe elective, maybe something that's not required, but an elective that's just focused on lifestyle, nutrition, lifestyle, exercise, physical activity?
Absolutely. And that's oftentimes a good place to start, because once student interest starts to grow, they start to say things like, we should have this, our continuing clinic curriculum, which is 4 years and is online and stuff. And so an elective is always a great place to start. We do have a nutrition elective that Dr. Betty Dries does with our biochemistry PhD that does focus solely on nutrition, but may have room for a lifestyle curriculum or exercises medicine as a place to start, so that you're not just starting new, and you can partner with others. And I think it would be really powerful to have a dietitian as another professional in that elective, and that would be a great place to start. And I can help connect you if you want to. I'm not sure if Betty's still involved, but I know Darla McCarthy was, and so I can help connect you with them to do some really amazing stuff with an elective. And they're 4-week blocks now.
I don't know about everybody else, but I think that might be a place to explore. That seems like a good way to get our foot in the door, is maybe exploring what an elective kind of class would look like.
Yeah, I think that's a great idea.
I
Another
will tell you,
even,
it's much. Oh,
oh,
sorry.
go ahead.
It is much harder to include the other professional students because they don't do a block clinical rotation like the medical school does. School of Nursing, Dentistry, and Pharmacy tend to have semester-based courses. But we do have some little gap moments between semesters where they can take electives. We just haven't found that they signed up for them when we cross-list them. So it would just be primarily for medical students, but it's a great place to start.
I was just going to say another potential option would be going at it from a student interest group level, because then that could be more of a, quarterly sort of meeting, something like that that could happen longitudinally over students' careers, incorporate other professional students as well. That might be another opportunity.
Yeah, absolutely. We at UMKC School of Medicine, like Shelley mentioned, do have a Walk with the Doc student interest group run by our UMKC Medical Student Wellness Committee. And they oftentimes, because it's Walk with the Doc, they haven't involved other professional students, but other professional students have been interested, namely those that are already interested in running and walking and exercise and wellness. So we can certainly include them in our group. And we already hold Walk with the Doc events twice on Saturdays and Sundays now with our Healthy KCE side event. And so they're already very active. There's 35 students who are engaged in that at this time. And so I would love to engage more professional students. It's a little tougher because doc's in the name, but I do know there are some pharmacy students who have been getting more involved.
Yeah, and that's one of the reasons, Shelley, we had decided to shift from the Walk with the Doc to their other brand, which is the Just Walk, which is any other healthcare providers who can lead the walks as well. Stephanie, can you just elaborate for just a second when you guys are holding your walks, at what time and what locations?
So right now we aren't holding the walks just yet. At the community events, it's called Talk About Walk with the Doc. Or Talk with the Doc about Walk with the Doc. I don't know, it's kind of a long title, but we have our banner and they have their t-shirts. And what we do is we take a topic of interest. Like right now it's 100 reasons to walk. And they talk about the health benefits of walking. So we're at a table in outdoor events that are also Jeanette Berkeley Patton's group. So she's doing her research element. There are hypertension and diabetic screenings going on. And then there are also vaccine clinics when they can have them available that are there, along with neighborhood groups that have a number of other things going on. So we actually didn't know there was a walking trail. And unfortunately, the participants and clients didn't wear appropriate shoes. But they said, if you want to take a walk with us, we can talk about these items on a walk. But none of the clients signed up for that. They mostly asked a lot of great questions about healthy choices for nutrition, which I was able to send the students a couple of the things that I had to talk to them about that. And that's part of that Jackson County grant that's out there for our Healthy Kansas City East Side. And it is really popular. They're trying to give me 3 events a weekend. And I said, okay, I've kind of reached my limit because it's really popular. And our students know they're not there to treat or advise. They're not there as doctors. And even their t-shirts say future doc on them. But the neighborhoods are very interested in this element. And so they're wanting more, but I'm getting to my limit, but we're not walking. Our first October 20th event is coming up, and we're trying to arrange a walk with the Veterans Association. And it's actually more of a community group. It's not with the hospital. And so we're going to give it a try following the COVID precautions and adequate spacing and masking. And so we're building that now. So I don't know what it looks like, except that I'm just following all the guidelines as the faculty sponsor to make sure we do so safely. So we'll do a little 15-minute talk, and then we'll take a 30-minute walk. And our goal is we have 5 team leads that are upper level students that are UMKC Wellness Coordinator, like they run the interest group. So they're going to get thoroughly educated on the talking points for that particular walk. And then we'll have other junior students kind of spaced out so that they can pace but maintain 6 feet and make sure everyone's doing okay. We'll walk for 30 minutes at the area of their choosing by the VA. and an area that's easy for their members to get to. And then the last 15 minutes will be debriefing and answering questions, which will mostly be shouting as everyone's 6 feet apart in a grassy area. But they're excited to actually do a walk with a group of clients. So we'll see how it goes. This is kind of a pilot for us.
Well, best of luck to you. I'm so excited to hear how that goes, and please give us any feedback that you guys figure out from that walk.
Oh, absolutely. We're excited just to get one going. I had to cancel a couple of other in-person events with our program, so I'm hopeful, knock on wood, that we're going to be able to pull this off and get feedback from them on how often they think they can do that, if they need our support, or if they feel like this is a group that they can become, partners to walk together, to encourage walking as a healthy choice. And we'll see how it goes. I'm excited.
That is very exciting. I'm very proud of you guys for getting this going during this time. So at least the weather is cooling off, so wearing masks outside doesn't seem as unbearable anymore.
Yes. Yeah.
Well, thank you guys for those updates. I just had posted the KCPA Plan website in the chat if any of you wanted to look at that. What we are working on is, like I said, that healthcare sector, and there's 4 different goals. So you guys hit a lot on those goals that we were talking about. And some of those are trying to introduce wellness and exercise into curriculum and into education. But then another goal is to actually leader that ourselves by showing how we are physically active and doing all the things we're actually asking patients to do. So there's 4 different goals that we're working on, and all these things, all these tiny little pieces integrate into those goals. Robin, you have your hand up.
Yeah, I was just going to follow up on the point that I think it was Dave was mentioning about CPT codes and billing codes. And maybe I'll talk about it a little bit later. We had a great seminar speaker last Friday from the University of California, San Diego, and she's doing a lot of this same work out there. And within their electronic health record, I didn't have time to ask her because it was a full presentation and there were lots of questions, but in one of her screenshots in the electronic health record, they had billing codes, ICD-10 and CPT codes, it looked like, that were in the system for exercise, for exercise reimbursement. And so we're happy to make connections with her. Potentially she's working on this as well. Just something to add.
Yeah, great. If you could find those and share those with us, that would be wonderful. Is anyone else in their current practice finding that they're getting reimbursed for like nutritional counseling or anything like that? Any ICD-10 codes that they're using? I feel like we've been talking about billing a lot, especially in our practice, and we are, primary care at Children's Mercy. So we aren't necessarily like a fee for service. We're more under that capitated Medicaid umbrella. So it's harder for us to get reimbursed for nutritional counseling. But maybe if someone is in private practice or knows of additional codes, or definitely some of the subspecialists, if you guys know of any codes, please let us know.
Our dietitians at CMH are billing independently for nutrition now. And it's a relatively newer thing, but I'm not exactly sure what the mechanism is there of how they're doing that.
And Dave, what codes are you using?
What was that?
What codes are you using?
You got to put me on the spot like that, don't you? I will. I use counseling in bariatric. I will send them to you.
Great. Good enough.
So I do a lot of this counseling, but because of the nature of subspecialty care, I have functional goals and ramifications on my type of counseling for kids with disabilities. So I would be interested, though, to kind of coordinate with this, or help try and figure this out to see if there are some specific codes that others can use, for sure.
Well, I am glad you brought that up, because we were talking about forming some subcommittees for some of these projects. Just like we did over the summer for Walk with the Doc, we started, gosh, what was that, Shelley? I think late June. We started forming our subgroups to try to get this walk going in September. And we were doing every other week meetings over the summer for like 45 minutes. And the timing was just based on who was in each of those subgroups. And I think if we're going to try to move some of these forward, instead of having the big meeting with all of us, it would be nice if there were a few people who are interested in each of these topics who would be willing to move forward together. So Walk with the Doc, or Just Walk, is one of them. And if you aren't already on that and you want to be, please let us know. The second one would be trying to figure out reimbursement and billing related on nutritional counseling and exercise. And then the third subcommittee would be the exercise as medicine, and trying to figure out how to get that into the curriculum, maybe not only in the med schools, but also, nursing, PT, dietitian, anyone else who we can get that curriculum going. So if anyone is interested in any of those three subcommittees, please, please, please either email Shelley or myself, or put that in the chat, and we'll get a hold of you as far as setting up the first subgroup meeting. And then I'll put those in the chat, the different options. And then while we have 15 minutes left and we have a lot of extra people on the call that we haven't heard from yet, does anyone else want to talk about what they're doing right now in their current work to try to help promote exercise?
Hey, this is Dan at Pedigo. I just was a little late getting on the call. Can you hear me okay?
Yes, we can hear you.
Okay. Yeah, we've been doing kind of just outreach at some of the farmers markets. We do our weekend farmers market. We pull a tent and just kind of do rides, free rides on our bikes, and kind of talk a little bit about the Revolve, one of the bike shops here that kind of gets, they have a sliding scale, and they offer bikes. If they can't afford a bike, they have access to get one there, and or they can purchase one. And then we just do, like I say, our free rides. If there's any, and then we're doing Ronald McDonald and a couple other events just for kind of children's services, health, for their auctions and fundraisers. And we're always looking for fundraisers to do. So we talked about doing something up at UMKC, and I could let it drop, but I'm always available to do and maybe get a couple other exercise fitness groups to kind of support and fund an event there at the university for students, faculty, and just community at large. We're also doing an event out at the trail. It's at the Crane Brewing. We're going to be doing some pop-up tents out there. It's right on the trail, and we just talk about exercise and our bikes in general. And then there's a commuting event going on. It's kind of, they're working it through the KC Ride. Am I saying it right? Ride Share, I think it's called. Ride Share KC. That's it. They're the ones that also provide the bikes, regular and e-bikes throughout the city. It's the bike share program. I know they have this month have been pushing a commuting program for employers and individuals who want to get out, get active. There's prizes and different things. So that's been going on. I can't tell you what kind of success or how many are signed up in it, but that's some of the current events that are going on. And like I say, we're always, right now it's a good time there's a lot going on. I think St. Luke's will be supporting the art fair. They're one of the sponsors of it. It's probably a little late for that opportunity, but we're going to be down there doing free rides at that too. So kind of thinking outside the doing some of those things. So if anyone has any ideas, or we could do walk with the doc and ride with the doc. So I'm open for any ideas that you have that way. Thank you.
Thank you, Dan. And if you have like, I put the Pedigo website in the chat, but if you have a specific web page that has your different farmers markets and different places you're at, you can post that as well, or send that to us.
Great, I will do that. Thank
you so much.
And I'll get signed up with the couple of those groups too, the reimbursement, and we can check with CMS on the guidelines, because a lot of those guidelines come through the Federal Register. They won't break it down into diagnosis code, but there is someone up there that can guide us, that probably has those codes, that can tell us a little bit more what setting, what type of providers can provide those nutrition and exercise, because that would be a policy. If it's Medicaid, it's federal state share, so they would guide, the CMS would be guiding the states on how that's covered. I'll do some research on that.
Great, I will add you to the list.
Mm-hmm. Thank you. Yeah, the reimbursement and the exercise is medicine with the med students.
Excellent, got you down.
Thank you.
Yeah, thank you. I think someone else was maybe gonna jump in on something they've been working on lately.
Hello, my name is Ozzy, for those who can't see me. Daphne, Dr. Bascom actually had me come over here to this work group, and so I wanted to update you guys on what we've been doing. Actually, what we did last week, we actually saw some walk with the dog green T-shirts out behind the Boys and Girls Club trail. They have a trail back there. I think it's on Parallel. And so we were out there with our Reach In participants, walking with them, and we're having some kind of like, obviously, so some struggles in having those folks sign up for those morning walks, or trying to find maybe some other times that could accommodate our participants in the program. But whenever we did have a family there out on the walks, they seemed engaged, like they were having conversations with us. It wasn't like they were just walking behind us and we were just walking in front of them or something, like line leaders or something. So it did feel like they were there, and that they would be interested in participating in more of those. I guess we were just calling them morning walks, but so I guess I am here also to contribute and to get some ideas on how we can generate some buzz around active living.
We love that. Is that the first one you guys have done, or have you guys been doing these monthly, or?
Yeah, that's the first one we've officially done that we kind of recorded. We did something kind of to touch on, I think it was, I don't know who was on the chat that said something about recommending a virtual walk. So that morning we had a Zoom session already live. So we just went on our phone and kind of recorded the walk. And there were some folks on the call as well, but they weren't engaging. So it's also difficult to, I think we're going to have to find a way to get like a nice, like a windproof microphone or something, because I don't think anyone could hear anything I was saying as we were walking. But
yeah,
I
especially
believe
if you're a fast walker, Ozzy.
Right. I believe that maybe that could work, a virtual walk of some sort, or maybe a pre-recorded session. I think that was also kind of in the chat. And that way they can take their phone with them and have their earbuds in and walking with us without actually being there live in a session. So they could do that on their own time. But yeah, just some updates for you guys. And I would love to participate in the EIM.
I'll put you down.
Yeah, sweet.
Great. And if you guys have, again, any resources for what you're doing for that, Ozzy, please send them my way, because I might have some patients that I could kind of let them know if you guys have a website or something that has that information when you're doing the walks.
Okay, great. I'll go ahead and put her.
I think Sammy had mentioned the virtual walk. Do you have any other information about that?
Yes, I will not say we've done as much virtual walking as more virtual, like exercising from your home, just because it's been hot and the masks and people getting out. So what we've been doing successfully has been really trying to do like a 15-minute workout that includes like a warm up, a little bit of heart rate up and some stretching our core. And that's been a lot more successful in our healthcare system. So for those of you that don't know me, so I own my own company, which is a kind of healthcare, specifically oncology exercise, but I contract for HCA Midwest. So we've been doing a lot with like our cancer care teams and these 15-minute once a week things, and had a lot of participation from like nurses and rehab therapists and our physicians, et cetera. So I think short and sweet and quick access has been really successful. And I specifically usually demonstrate in like work clothes to show you can squat in a skirt, which I know for the guys on the phone, that isn't that big of a deal, but it's been kind of interesting. I think that is key for sure, Sammy. If you can fit it in 15 minutes, then anyone can exercise, right? Yep, definitely. Yeah, and I know you've given us the information in the past, but can you add your information again to the chat, please? Sure, no problem. Yeah. I think maybe our next work group, you should just lead our exercise during this time. That would be great. We all need 15 minutes, right? Yeah. Yep. We should start with that. I agree. Because most of us are missing our physical activity right now over the lunch hour. So we're all sitting here on our convenient meetings. Yeah. Yes, that's right. Okay. Anyone else? We have just a few minutes left before we wrap up. So I'll give someone else a time to chat.
Before we do that, Jody, I wanted to make sure we come back to the conversation about follow-up meetings for the healthcare sector group. We've talked a little bit about going to every other month meeting or quarterly meetings. So as we set up these subgroups and want to move some of these strategies forward, we realize it can be hard to have multiple meetings every month. So wanted to get this group's feedback in terms of how we want to manage this, since most of this really is sharing updates and then connecting people to the different resource or to the different subgroups that we're trying to set up. So I wanted to get thoughts on that, first of all. And then second, I wanted to share some information about how we're going to be following up with the group moving forward, because we want to make this easier for anyone to access the meetings and share the meetings with other people who might be interested without having to go through us. So a couple of updates. We are going to be shifting from a Teams format to a Zoom format. We are going to be sending out evites for meeting notices. The reason for that is to make it really easy for you or anyone participating to add the meeting invite to their own calendars, and for you to share it with others to make it easier for them to add to their own calendars. So look for that information in the future, and we will be communicating updates like from this meeting in a new format. We're going to be sending it out as an email using MailChimp. It will be a little bit more attractive. It will be, we'll have the next meeting information in there. We'll have subgroup information in there. And we're happy to share any resources you all have that you'd like the whole group to see. For example, we can share Dan's information about Pedigo. We can share Sammy's information about her 15-minute Tabatas that she's talked about. We can share anything else that you think would be valuable to the entire group moving forward. So That information can be sent to me, ssummer@cmh.edu. I'll type my email in the chat. But wanted you to be sure to look for that. So moving forward, it's going to look a little bit different than it has in the past. The past, I sent meeting invites. This is going to be more an email distribution list with all the information in it, and you can engage in the way that makes most sense for you. Any questions about that as I blew through it?
I think the goal for all of us is just to have less overall meetings, but get more work done in between the meetings with these subgroups, as I'm sure all of us would appreciate a few less meetings on our calendar. And I just have a running list of what people have told me so far, so please confirm me if I'm wrong. For the Just Walk group, we pretty much have that already running, so if you want to be added, let me know. Exercise is medicine. I had Sammy interested, Ozzy. I'm gonna add, Jay and Stephanie. I can't remember, Dave, did you want to be part of that one or not? Yep. Okay, and then the billing and reimbursement. I have Dan, Mark, Dave so far. Anyone else that I missed on either of those groups? Okay, you always have our email addresses. What was that?
Oh, this is Dan. I would also be interested in exercise as medicine.
Yes,
too.
You're right. I had it down. Sorry. Thanks for correcting me. Yeah.
Thank you. Thanks for all you do.
Thank you guys. I appreciate this. Meeting's not possible without you guys participating. Sammy, monthly challenge, 50 air squats per day. Oh my goodness. I like that. If we start a challenge here, it's much easier to share our working peers. Okay. Anyone up for a monthly challenge?
I think that's a great idea, and let's include that. So Sammy, I'm going to reach out to you as I'm putting this information together to share with the group to include a just for fun section and have that be part of it.
I love that idea. I think we could do even like a quick little video and then ask for people in this committee to come back and like just share, hey, I fit this into my lunch and I recruited all the people in my office or something. That's awesome. Going back to some of our conversations, we just need to make it really simple and easy. I'd be happy to help with those ideas.
Thanks, Sammy.
Sammy, I am on a 2-day streak of 10 push-ups.
That's awesome. Push-ups are hard. Good for you. Well, I'll be reminding myself to ask you how that goes and keep it up now that you've been accountable. So you verbalized your goal. Good job.
That's right. Uh-oh. Well, thank you guys all for joining us. I think that's it for now. Please keep sending us our ideas, and you can even add to the chat after we get off this meeting so we can follow up. All right. Thanks, guys.
Thanks, everyone.
Bye.
Thank you.
Thank you. Bye.
Thank you.